Hey, hello everyone. I am Swapnil Banerjee, and today we are going to discuss about the blood supply of brain. So it is really a very important topic, and it is my first video. I'm just recording with using the mic of my earbuds, I think. So starting with the blood supply of brain, the brain is mainly supplied with the carotidovascular system. So it is mainly formed by the vertebral artery and the internal carotid artery. So if we just try to discuss it all in one video, then it will be very much lengthy. So we'll break it in a few videos. In the first video, we'll discuss about the vertebral artery itself, and the next video the carotid artery, internal carotid artery, next the circle of Willis, and thus we'll proceed and complete this topic. I hope you guys will enjoy. So let's start with the video. So our main topic is blood supply of brain, and it is done by the carotidovascular system. So today we are discussing about the vertebral artery. So discussing about the vertebral artery, at first you'll have to know that it comes from which artery. So it is a branch of subclavian artery. Okay. So subclavian artery gives a number of branches and it has three parts. One, two, 3. And who divides it? It is divided by the scalenus anterior muscle. So scalenus anterior muscle, it divides the artery in the three branches, and from the first part our vertebral artery arrives. So from the first part there comes three arteries, so we shall write their names. So one is our vertebral artery, and the second one is internal thoracic artery, and the last one is thyrocervical trunk. Okay, so these three come from the first part of subclavian artery. From the second part there comes the costocervical trunk, and from the third part there comes another one, and that is the dorsal scapular artery. So total we have 5 arteries, and from the 3 parts and 5 arteries. Now when we are discussing about the vertebral artery, so it has 4 parts. Okay, 4 parts. So coming to the first part, we have to remember a relation here. So here with the first part a relation comes the stellate ganglion. Okay, I hope you guys are familiar with the name stellate ganglion, but still I would like to tell that it is formed with the inferior cervical ganglion and ganglion plus first thoracic ganglion. Okay, so why it is very important? Because whenever we give a stellate block, we never give it on the position of C7. We never give it. We give it on the position of C6. Why? Because at C7 the first part of vertebral artery is in relation with the stellate ganglion. So if we somehow make any kind of mistake, we have a chance of damaging the artery, and we never want that, right? So this is very important. You will have to remember this. Now coming to the second part. Okay, so in the first part I forgot one thing, that you have to remember the landmarks. So it is in the part of C7 as we already discussed here. So the second part is from C6 to C1. In the landmark of third part, it is in the suboccipital triangle. Okay, and the fourth part and the last part, that passes from the foramen of magnum. Okay, I'm sorry, I think, okay, now I think you can see it, foramen of magnum. Okay, so this is the part where two vertebral artery crosses the foramen of magnum, and here forms the basilar artery. Okay, so this is very important because basilar artery you guys will understand when we'll discuss circle of Willis. So now third part we have already said it is in the occipital triangle, suboccipital triangle. And the second part, so second part, there is one important point, that it runs in the posterior arch of atlas. It is a very important landmark, so try to remember this one. So here are four part vertebral artery, four parts: first part, second part, third part, fourth part. If we summarize it, the first part is at the landmark of C7. What is the relation with it? Stellate ganglion. What is stellate ganglion? Inferior cervical ganglion and first thoracic ganglion. Okay, so whenever we give a stellate block, I shall write it here, I hope. Just take a pen and paper and note it properly, fairly, because if you can take a screenshot, but I don't think you will understand anything from here, so better you make your own notes, otherwise Okay, so stellate block, we never give it on C7, never. We give it on C6, okay, because we can damage the artery. Second part C6 to C1 and runs in the posterior arch of atlas. Third part in the suboccipital triangle, and the fourth part in foramen. It passes through the foramen of magnum. So which structures passes from foramen of magnum? Our spinal cord. I can write it here. Spinal cord. Many more important structures, and they are very important. We shall discuss that in other video, maybe in the video of foramen of skulls. Okay, so fourth part spinal cord, and there runs the vertebral artery. The two arteries come and form the basilar artery. They are very important in the formation of circle of Willis. Okay, that was it for the video. I hope you guys could learn something new from this video and could understand the topic properly. So if you guys enjoyed, then you guys can share it with your friends and like, subscribe to my channel, and yeah, see you all in the next video. Bye.